Let's discuss spleen qi deficiency. Spleen qi deficiency is, alongside liver qi stagnation, probably the most common pattern one meets in the clinic. This is mainly a consequence of the diet that many people consume and the way in which they eat their food, which often puts a great strain on the spleen qi. Most patterns of spleen imbalances are simply variations of spleen qi deficiency. Furthermore, spleen qi deficiency is often central in the creation of patterns of imbalance in many other organs. Several of these combined patterns become self-generating, where one pattern results in the creation of the other and vice versa. The primary cause of spleen qi deficiency is consuming food and beverages that are cold in both their temperature and energy, raw foods, and food that is unrefined or damp producing. Eating too much at a time, eating too quickly, or not chewing the food enough will also burden the spleen. Although eating several small meals is better for the spleen, constantly snacking will also strain the spleen because it will constantly have to transform the ingested food. This pattern is due to spleen qi deficiency and failure of transportation and transformation. It is also called spleen failing to transform and transport. Key symptoms: abdominal distension, poor appetite, loose stool, along with the qi deficiency pattern. Clinical manifestations: abdominal distension or bloating, especially after meals, poor appetite, lack of ability to taste foods, loose stool, lassitude of the body and limbs, fatigue, lack of strength, shortage of qi, laziness in speaking, emaciation, sallow complexion or obesity, edema, a pale tongue with a white coating, a moderate and weak pulse. This pattern is usually caused by irregular diet, overstrain, fatigue, damage, overthinking and overworrying, impairing the spleen, hereditary weakness, deficiency with old age, or improper nursing care in severe diseases. Spleen qi can also be weakened by excessive worrying, speculating, studying, and ruminating. Prolonged illness, excessive bleeding, and overexertion are also a burden on the spleen because it has to replenish the qi and blood that have been consumed or lost. Chronic liver qi stagnation will often lead to a disturbance and thereby a weakening of spleen qi. Finally, living or working in a humid environment can strain the spleen because the spleen abhors dampness. Etiology is excessive consumption of cold and raw foods, which hinder the spleen, irregular eating and eating too much, excessive mental activity, anxiety, prolonged exposure to damp, chronic illness. Underlying or accompanying pathology: stomach qi deficiency, spleen yang deficiency, lung qi deficiency. Signs and symptoms: poor appetite, abdominal distension after eating, tiredness, pale or yellow complexion, pale or dark lips, dizziness, low voice, shortness of breath, weakness of the limbs, loose stool, slight depression, tendency to gain weight. Pulse is empty, tongue pale, thick coating. Treatment principle: supplement the spleen, warm the lower burner. Acupuncture treatment: Ren 12 to fortify stomach and spleen. Spleen 3, yuan source point of the spleen, bladder 20 to supplement spleen qi, chronic. Ren 4 to supplement the qi. Stomach 36, supplement spleen qi. Spleen 6 also supplements the spleen qi. Bladder 21 to supplement stomach and spleen qi. Ren 6 to warm the lower burner. We needle with supplementation and moxa. Dietary changes are alpha and omega in the treatment of spleen qi deficiency. This encompasses both what is eaten and how it is eaten. A person who is spleen qi deficient should eat as much prepared and warm food as possible. They should avoid raw vegetables, salads, food that is very coarse, cold drinks, ice cream, and food that generates dampness, such as sweets, dried fruit, artificial sweeteners, honey, stevia, dairy products, bananas, avocados, and so on. They should avoid eating too quickly, too much at a time, and while reading, watching television, or working. They should chew their food well and avoid drinking too much at meal times. They will benefit from eating soups, mashed vegetables, purees, porridge and morning, stews, steamed or boiled vegetables, and baked vegetables. That is food that is easily digestible and preferably warm. The weaker their spleen qi is, the more digestible their food should be, as long as it does not create dampness. Drinking a small cup of ginger tea at mealtimes will help to fortify spleen yang, thereby assisting the spleen in its transformation of the food. The use of herbs in the diet, especially aromatic spices like black pepper, ginger, cardamom, garlic, cumin, caraway, and nutmeg, will also assist in circulating qi, dispersing food stagnation, and transforming dampness, thereby alleviating the burden on the spleen. Foods that are particularly beneficial are rice, oats, barley, most vegetables, especially root vegetables, squash, sweet potatoes, and those that are yellow or orange in color, red lentils, tofu, chickpeas, and chicken. It is important that the person does not regularly sit still for extended periods of time and that they do not sit in a slump posture. Walking or stretching after meals is recommended. Physical exercise in general will be beneficial as long as the person does not overexert themselves. Stroking downwards with the fingers from Ren 16 to Ren 8 will help stomach chi to descend. Meditation is interesting in the context of spleen chi deficiency. Often we recommend yin activities like meditation rather than physical activity when there are chi deficiency conditions. However, meditation where you sit still for long periods of time can burden the spleen, and excessive mental focus can consume spleen qi. This does not, though, mean that meditation in itself is negative when there is spleen qi deficiency. It just requires taking certain factors into consideration. If you're able to meditate with an empty mind, then it will be beneficial. Meditation is also an excellent tool to reduce the tyranny of worry, speculation, and repetitive thoughts. Walking meditation will generally be a better option for a person who is spleen qi deficient, as walking circulates qi in the middle jiao, while sitting still can cause qi to stagnate in the middle jiao.